You're listening to the Jōrni Podcast. Most of us think we know what dentistry is until we experience it as a gateway to whole body healing. Could we actually start to love going to the dentist? You might be surprised by today's episode. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we take a fresh look at dentistry and uncover how the health of our mouths influences our overall well-being. Our guest shares insights gained from over 2 decades of practice, highlighting how dental health is deeply interconnected with the neck, spine, and other parts of our body. Dr. Yasaman Roland has been practicing comprehensive dentistry for more than 20 years. She realized early on how dental issues are not isolated, but often depend on neck, spine, and other interactions throughout our bodies. Over the years, she has developed signature treatments that draw from all of these disciplines to provide individualized care for each patient. Her passion is to provide overall wellness and long-term balance within the body and smile for every individual of any age. Here is my interview with Dr. Yasaman Roland. Hi, Dr. Roland. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because whole body dentistry is a very, very curious subject. And listeners, please don't turn off the episode right now if you're scared of dentists like I am, because we're going to be diving into something very, very interesting and exciting with Dr. Roland. Thank you so much for being here, Dr. Roland, and welcome to the podcast.
Thank you very much for having me. I'm very excited to join and talk about what is out there.
Yeah, that sounds wonderful. And for starters, would you like to share a little bit about yourself, maybe? I would love to hear some of your own story or journey, how that connects to what you do today, and maybe give our listeners a little bit of a glimpse of what it is that you do today.
Sure. I specifically focus on practicing functional whole body dentistry, and it's for adults and children, all families. And I focus on making sure that your body is functioning at optimum and it's very healthy, because that's very important for complete wellness, not just physically, but also emotionally. And I really focus on that. I think it's important. My own journey, I started practice as a regular dentist doing traditional dentistry. And as time went on, I always had a lot of questions outside of the box as to why and how. I really always thought outside of the box. And I wanted to pursue what it really means to fix all of the problems that I see. Things such as, why do teeth crack? Why do people grind their teeth so much? Why is there so much dental disease? There's a lot of whys that we forget about, and we focus on just treating those symptoms and fixing what we see in front of our eyes. I'm personally very interested and involved in personal health and wellness, so I decided to carry that on into my practice. So I started the journey, and I did lots of research about this and found a lot of incredible science and knowledge from other elite professionals, and started to study. And I study and developed my skills and started applying one patient at a time. As I started to apply these skills and I saw these amazing transformations, it was just incredibly exciting. And I could not look at dentistry the same way after that. And then after a little bit of time in my own practice with this mindset, I became a mom, and that made me even more interested in your organic health and being physically and emotionally very well. And for the sake of my own children, I also was very interested in continuing this journey and applying these skills more in my practice so that I can help a lot of other children out there that are really in need. And the focus from this is just lost. And I wanted to be able to give all families, and especially the children, the healthy life long term that they need with stability. That is my special focus and interest.
Wonderful. Thank you so much for sharing your journey and your passion with us. I think we often have a very narrow focus on what dentistry is or should be. Teeth are kind of looked at as these things that cause a lot of problems. When we patch up these symptoms, we put in fillings, and a lot of us have to put up with braces and headgears and all this fun stuff that comes along. But I hardly ever hear anyone talking about how our teeth and all of that connects to the rest of our body. It's almost, when I go see the dentist, a very separate and isolated thing. We only look at the teeth. We don't really even look at anything else, say the face or the muscles or anything else, just the teeth. And it seems very isolated. I'm very excited to hear that you look at this with a very different perspective. And I would love to invite you to share the quote that you had shared with me previously, because I feel like that really puts in perspective a lot of what you just shared with us.
Yes, thank you. I actually created a quote that describes what our practice is about. The quote is: "The power of breath, balanced posture, and a beautiful smile lead to a healthy transformation." And that really has a lot of meaning because a lot of people, a lot of especially kids too, they present with something as simple as very crowded teeth. And that is telling a story because those teeth are actually inside of your jawbones. And those jawbones, if they're too small, they don't have enough room to accommodate all the teeth that we have been given. If we think about how many wisdom teeth are being taken out in today's world, if we think about how all this crowding is happening and all this dental disease is happening, there is a reason. If our jaw is too small to accommodate, let's think beyond that. The jaw is part of our entire skull, which is basically our head. And our head is sitting on top of the atlas to support it. And then we have another part called the axis beyond, which helps our head rotate. And then beyond that, we have our spine that basically goes down. And then we have everything else coming off from it. In front of that, we have the rib cage. And then we have other very important organs that are encased in this, like your lungs and your heart, things that are so important for the vital functions. And if there is not enough space inside of the mouth, then that is going to impinge on that breathing space, which is essentially your nose. And breathing through your nose is so important because that clears the air, filters the air. It takes in that oxygen that's so important to deliver to your cells, to help your cells thrive, give you energy. It's the fuel for your body. And it also stimulates your sinuses to create something called nitric oxide, which is really an anti-inflammatory. It boosts your immune system. If you are utilizing your mouth to breathe instead, because that nose is not able to be open enough to be used all the time to breathe, and there's not enough space there, then none of that nitric oxide happens with the mouth. None of that air filtration and clean air happens with the mouth. You're just basically trying to survive. that is going to affect the way now that you posture your head, for example, because you're trying to make it easier for your body to take in a breath. And when you posture your head in an altered way than nature wants you to, then that spine of yours is going to now compensate and bend or rotate and come and not be straight and centered like your body really wants you to, because the body is very interconnected. It likes to be centered, it likes space, and if all that is missing, it's going to compensate for itself. When that is also happening, then that means that now your rib cage is now going to be constricted too and not create enough space for those vital organs to function right. There's not enough space for them to expand correctly. That's how the body is connected. And we have to keep all of this in mind. And it's not necessarily that someone is not interested in functioning correctly or doing this. It's just the body is developing this way and restricting you to do that. So then that, I call it, the plumbing isn't quite there for you to be able to utilize the power of breath and how you're supposed to take in the breath. So my job is to recognize that and recreate the opening within this whole skeletal system that's needed for all this proper function of the body to happen. And also, I recreate that balance and alignment within the body that's so necessary for it to be centered and function correctly.
Wow. As you're explaining that, I'm realizing how many things are coming together actually when we talk about just dentistry. That is absolutely fascinating. And no dentist has ever explained it like that. So I bet you that many people just aren't even aware of how many things are connected to their jaw, their teeth, their breathing, and the extension of all of that and the ripple effects it has on the body. So this is absolutely fascinating. The things that a lot of people are challenged with, of course, the very tight jaws, not enough space with their teeth.
Mhm.
I remember from when I was younger, the solutions were to just take the teeth out and try to make space that way without really giving much consideration to anything else. So how should we look at everything that is happening and conditions that we might have, like very tight jaw joints or locked jaw? Even a lot of people suffer from that, where I would even put in snoring and crowded teeth and all of those things. How do you look at that from a dentist perspective, that when you have someone in the chair, and where do you usually start to bring in the whole body in your considerations?
Well, I actually start to bring in the whole body right away, because when the jaw isn't working right, that is a sign that the rest of the body is also not working right. Because the jaw is connected to the base of the skull through a little delicate joint called the TMJ. And this TMJ, it helps you eat, it helps you yawn, it helps you speak. It does so many things for you that we don't really even think about. If this connection is not ideal or in its natural place, then the part of the body or the other side of the body is going to compensate for that and re-establish a different direction of how things are connected. And then those muscles are going to work hard to allow you to function. I look at the whole picture and see what is compromised in this connection and why. And nature intended you to be a certain way and have the ability to function ideally. But if that's taken away, then I'm looking at this whole perspective and sort of guiding the body back to balance and allowing it to find its natural position and regain its strength to be able to work efficiently. That means making sure that all of the bones connected within the body are within good space, good alignment. We know naturally where things are supposed to be to work at its best. And then those muscles are going to also rearrange themselves and become very comfortable in how they work and what they're doing for you. And all those feelings of tension within the face or the jaw is going to go away. It's going to take away the tension from your neck, because now, if that connection is corrected, then your head connection to the rest of the spine is corrected. So all this stuff starts to go away. And now you can also even not have any limitations with how the jaw is functioning, and you can open and close beautifully. And then there would be enough space for your teeth that are supposed to be there to help you chew.
How do you usually achieve that in the absence of just ripping out teeth because there just isn't space, or taking out wisdom teeth because they don't fit? How would you approach aligning what is happening, or making space, or putting it in the right position? How does that look from dentistry perspective?
Well, the most important part is being able to diagnose what the situation is. And there's no one size shoe fits all. Every person presents with a different complexity, and every person has their own issues of how things are not working at its best. Important to diagnose that particular person in that particular situation. I use a three-dimensional scan that helps me see all of this and then be able to come up with what really is wrong and how I can fix it and guide it back to nature. And there are many different strategies and procedures that I bring in and I utilize to help the body regain all of its function and balance. It's first a combination of some structural work that's needed through specific custom design appliances that I would make to naturally and very gently and non-invasively re-guide those internal bones of the jaw and head and everything back into place. And then we also incorporate other ways through osteopathy and maybe sometimes craniosacral therapy to externally have those skeletal structures work together with what changes we're making internally. Because every part has to speak to each other and help each other like a baseball team. And those muscles that are part of all this, they're just going to guide back. And sometimes the more tense muscles, we find out how tense or how much more help do they need to regain their proper function. That would be muscles on the inside and outside. Let's not forget the important muscle on the inside, which is the tongue. Sometimes we need additional help of therapy, muscle therapy, to regain all of this. And we also will train the body how to utilize its organs for efficiency, how to learn to breathe correctly and not insufficiently. So all these are introduced within the body through training and so forth, along with structural changes that we can do with appliances and osteopathy and all of that. And then at the very end, let's not forget the teeth that are actually inside of all these structures. We realign those teeth to connect and stabilize together with the rest of the body. And yes, that creates a very natural, beautiful smile, but at the same time, it's really helping the body to function at its optimum. And now all the parts are really happy and they are comfortably in function. They have no reason to want to go back to how they started. Minimal maintenance necessary, but you can have a very healthy, long-term result with addressing your whole body to feel good and function correctly.
That was something I was just going to ask you that you just touched on now. I imagine with children, especially because they're still growing and everything is still forming and coming into place and they're getting taller, how long this actually lasts, or is this something that we have to continually maintain or work on and maybe, have some sessions also once in a while with some providers? What does that journey look like from sort of childhood and then into adulthood when we want to maintain these changes that have been made?
Well, I would say the beauty of childhood is the fact that they are very good at self correcting. Once we guide them into the proper way of growth that they have been taken away from due to so many different reasons, then they will develop very nicely and they should expect pretty much for the rest of their life to be functionally very great. And of course, our bodies, we're not stagnant. Our bodies with aging and our jobs and so many different things that changes happen. But when that core foundation is there, then it's good, it's solid. But then you can do minimal maintenance for just to give your body some break and give it time to regain and heal itself. You always want to do maintenance. And adults, of course, they're already formed and they may have developed these problems of sleeping problems or jaw problems. So we think we can't fix that. That's just the way it is. And then they decide to, or they come accustomed to living in pain or irritability, or they just manage it with medications. But you don't really have to do that. You can actually change the shape of bone, regenerate cells. You can do so many things to recreate that foundation, even for adults that have these conditions, and allow the body to work like it was supposed to naturally. And since those adults have been obviously more complex to fix, then it's recommended that they just do some minimal maintenance just as a routine, just like you go to the gym and exercise because it's a healthy thing to do.
Yeah. Wow. This is incredible. And I'm just realizing as you're explaining all this again, so how much impact there can be in whole body dentistry versus just going, having a quick scan, making sure there's no cavities and sending you on your way. So I feel like this is something we really should be putting as foundational care for children already. So as you said, that we can actually catch this very early on and ensure that they're growing into not having so many issues later on as they're becoming adults. So that sounds really, really fascinating. I feel like there's also a psychological component to dentistry, and that many listeners, and myself included, might have certain fears and very bad experiences from going to dentists. So, does that figure into your approach as well at your dental office, at your dental clinic, on addressing that psychological component of why people might actually just not even want to go to the dentist in the first place?
Definitely. I always kept that in mind in the beginning, especially when I became a dentist. And that's no secret. I think a lot of people have those feelings. In our practice, we actually created an environment where we want people to come in and enjoy coming in, that they have that feeling of transformation from the moment that they walk into our office. We want them to feel welcome and warm and comfortable, and they don't have that feeling of being at the dentist. And they look forward to coming in. That is our goal. And I have to say that we have been blessed with patients who actually feel that way coming into our office. And the journey is, in the beginning, they feel coming in this way, and then we want them to continue to feel this comfort as we provide them with any kind of treatment. We provide regular dentistry also, but We want to make sure that it is healthy. We want to, ingredients matter, how we apply the therapy matters. So, all of these with people knowing that they're receiving this kind of care, not just for the science part, but just for the comfort part of how they feel being in our environment, just makes it a complete transformation. And this is what we want to provide for all families here in our practice.
That really makes me want to get on a plane and come and visit your office. It actually sounds like a place where people would enjoy to go and get the care that they need to feel healthy and to be healthy, instead of being so afraid of that and having often very, very negative experiences. So this sounds like a great place to be. And hopefully you will branch out in many different states and offer this kind of experience to a lot of patients that really need that. Is there a connection for you that you have seen in your office between people witnessing that transformation in their own dental care and how that affects them psychologically, their well-being, how they feel, their confidence? Is there a connection that you have witnessed in your work?
Yes, with all of our signature treatments in particular, which is a lot of what I described earlier, it really creates this amazing transformation, change from how they were with how they look and how they feel. And none of it feels fake or even looks fake. It feels natural and looks natural. I have actually had a lot of compliments or a lot of feedback as to how life changing this has been for them. And it has been nothing but just wonderful feeling from both sides. So, of course, this not only boosts that person's confidence and their just emotional well being, I would say, for the rest of their life, but also for me, it's very rewarding because I can help people and provide this kind of care. So I would say both ways, it's a real great transformation and a wonderful feeling.
Yeah, I can definitely see that. And let our listeners know whereabouts you are located so that if they got curious by our conversation and they would like to try a whole body dentistry experience, where can they find you? And obviously, dentistry is a very in person experience, so they would have to be near where you are or travel maybe to the state where you are. But share with our listeners where they can find you.
Well, our website is transformativedentist.com. So feel free to go on there and read. And we have patients that actually do travel from other states to come see us. And we definitely welcome everyone who is looking for this type of care. And you can email and of course you can call, but the best way is to go on the website. And we're located in Annapolis, Maryland.
Amazing. And we will be adding this information to the show notes as well so that our listeners have your website address and they know how to connect with you. And if you are in the Annapolis area or you're willing to travel, maybe you want to go on a road trip and experience this type of dentistry that Dr. Roland has been sharing with us, then maybe a little trip to Annapolis would be a great idea. And you can probably combine that with some other fun things. But if the experience turns out to be as amazing as Dr. Roland has described, then I think even the dentistry in itself will be a very exciting appointment to go to.
Thank you.
Yeah, absolutely. Do you have any last pieces that you'd like to leave our listeners with when it comes to their dental health, and maybe a piece of wisdom or a piece of action that they could take away from this podcast before we wrap up? I know there's, like I said, a lot of fear and negativity around dentists and dentistry. Anything that you'd like to leave our listeners with that they could maybe change in their own habits when it comes to taking care of their bodies or their teeth or anything like that?
Well, just remember that your oral health impacts your entire body. So, how your body functions is so important. Always make sure that you just take care of yourself and you keep in mind how to take care of those children growing up. Definitely think about how you nourish yourself and just be well.
Yeah, thank you so much for that. And I think we often forget, especially with children, how important it is to already implement these kind of cares into their lives because their first set of teeth eventually will come out. So a lot of parents aren't very concerned about that, but good advice to start that early and to start thinking about that care very early on. So thank you for sharing that. And again, we will be linking to all of Dr. Roland's information for you. And if you're in Annapolis, make sure you have a visit and find out what whole body dentistry really looks and feels like. And thank you so much, Dr. Roland, for joining me today. I feel like we've put a little bit of good in the world today by taking care of some of those scary things about dentistry and showing that there is another way, there is another option that you can experience. So thank you for this amazing work that you do, and thank you for your time today.
Thank you for having me. I really enjoyed our conversation, and I really hope that others have enjoyed listening to us.
Yes, absolutely. I do hope that many, many of our listeners come and see you and experience this for themselves. And as always, let me know what your experience has been like when you go see Dr. Roland. I'm always curious to know when our podcast guests hook up with our podcast listeners. And there's a certain kind of magic that happens when their paths cross. So thank you so much for that. Thanks, everyone, for tuning in, and take really good care of yourself, Dr. Roland.
Thank you. You too.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.